San Diego's community clinics offer accessible health care for underserved patients. Now, 6 months after the Medi-Cal expansion and 1 year after more than 120,000 people signed up for health insurance through Covered California, they're seeing a lot more patients. Here with an update is my guest, Gary Roto, Public Policy Director for the Council of Community Clinics in San Diego, Imperial, and Riverside counties. Gary, welcome back.
Thank you, Peggy.
Now, what's the range of services, if you'll remind us, provided at the San Diego Community Clinics?
So the community clinics focus on primary care services, and that'll include medical, behavioral and mental health, as well as dental services.
And who tends to use these clinics? If you could tell us a little bit about the demographics.
Well, traditionally, they had been in medically underserved areas. A lot of people think of it as low-income areas. But certainly, over time, we've realized that we've needed community clinic-type services all across the county, all across the region. So you have a wide variety of folks, not only folks that are uninsured, though that's been traditional, and Medi-Cal, but also people that now have Covered California and some other health care as well.
I was going to ask you about that. So has the change as far as the Affordable Care Act and Medi-Cal expansion changed the demographics?
It started to. We don't have the precise statistics yet, but certainly we know that the number of uninsured, the percentage, I should say, of uninsured that the clinics are seeing has gone down. There's still a significant percentage, but it has gone down, and that's because of these programs that people are now able to receive some type of coverage.
How about at the actual clinics? What kind of changes are you seeing after all these people have signed up for insurance now?
Well, one of the things that the executive directors of the clinics did was anticipate this, and there was federal funding that was put aside for additional sites and for actually adding and expanding services. So you've had additional sites that have been developed in many different parts of the region.
Okay. As far as the Medi-Cal expansion, is that also the same as far as the changes you're seeing there? They're pretty in line with the Affordable Care Act.
Even more so.
I see.
Because there's about 243,000 individuals that have put in a new application within that 6-month period, kind of parallel to the Covered California open enrollment. Those are new applications. County is still working their way through. San Diego County is working its way through in determining eligibility. And so people are already coming into clinic or other types of providers. And not all, but many will now have some type of coverage and benefit from our services.
How much funding did you receive from the Affordable Care Act, and how is that money being spent?
Well, there are a couple of different pots of funding. One of the most prominent was called the Health Center Trust Fund. There was $11 billion that was put aside at the beginning of the Affordable Care Act, and that was then put into different grants that have been rolled out over the past 5 years, one of which was new access points, adding new sites or a center beginning or transitioning to become a federally qualified health center. Others were for additional hours and staffing for expansion of services. And then some funds were also put aside to dramatically increase the opportunity for new physicians that would probably make less than they could in other areas to come back to these medically underserved areas and receive part of their repayment, part of their loan repayment taken care of.
From their student loans for becoming an MD here.
Exactly.
But you also received you also received a big grant, I should say, that ultimately worked out to about $250,000 per clinic. What's that for?
Well, 5 of our members just last week received word that they're getting $250,000 to be able to expand their behavioral and mental health services. They'll be able to do things like hire a psychiatrist or psychologist, hire additional assistants, but be able to expand the practice, because one of the things that we know is it's important to integrate medical health and behavioral health and do it in the same place and possibly at the same time.
Well, I know you touched on this. There was a lot of fear that the Affordable Care Act and all these patients signing up for insurance would overwhelm the system. There wouldn't be enough doctors to see the patients. Is that something you're seeing at the clinics?
There still is a provider shortage, but the clinics have also done some things to transform their practice management, implementing patient-centered medical home that really maximizes a team working with the physician as the hub, so that you have not just the physician you're working with and not just when you're ill, but keeping you well and being able to communicate with the physician between appointments, being able to partner and provide some innovative care as well.
What do you see as the biggest challenge because of this influx of patients?
You know, the biggest challenge is how do you engage people not just in having coverage, but having coverage and coming to see their doctor at the right time, well ahead of when something is urgent or an emergency room visit is necessary.
All right.
Keeping them well.
Okay, Gary, thank you so much.
A pleasure.